and welcome to Meet the HRH Team Series. My name is Araminta Johnson and I work with Heather R. Hayes and Associates Inc. Meet the Team is a series of interviews where we meet and get to know all of the core people within the Heather Hayes and Associates team. Today, it gives me great pleasure to welcome Brad Johns, MD at Heather R. Hayes and Associates. Hi, Brad.
Hello.
Talk to me a little bit about your role at HRH.
I'm a board certified psychiatrist in the Atlanta area, and I've known Heather for 12 or 13 years and have worked with her off and on in many of my roles doing inpatient psychiatry and addiction medicine, and am now in the process of changing some of my practice and leaving direct hospital work and going to be affiliating with Heather with psychiatric consultations, that require medical evaluation of mental health and addiction. And I've always enjoyed working with Heather. She's, very, very sharp.
She is indeed. And what does it mean to be a medical doctor within HRH?
Many times they'll need consultations with a patient or a client of theirs for a full psychiatric evaluation of, their situation and their sufferings and their issues, which vary from mental health to addiction, and to provide that consultation services when they need it. Oftentimes it requires medication management for accurate prescribing, which is very unique, and especially when there's comorbid addiction in a patient or a client, that it's used appropriately and we're not using addictive medicines to treat somebody that also has an addictive disease. So Heather and I work with Heather and her team to make sure that the patients and the clients get the best possible care than whatever it is that's brought them to Heather's attention and consultation.
All right, fabulous. Thank you, Brad. And how long have you worked in this industry?
Wow. I started my psychiatry residency in 1994 and trained at Emory University. I'm still on the faculty at Emory and also at University of Georgia Medical College, teach the medical students, and I've been in private practice since 1999, so a little over 20 years. And I've mostly worked with very severe mental illness and addiction in hospital settings. And am, as mentioned before, moving more towards private practice and outpatient, not going into the hospitals as directly. Although I still will maintain hospital privileges, so should an admission be absolutely required, we would have some options.
Oh, fabulous. That's really important, I suppose. And can you tell me what the values are that drive you?
When people come to see a psychiatrist or an addictionologist or consult Heather, most families are in crisis and they need knowledgeable, multidisciplinary, from psychiatrists, therapists, social workers, everything, to accurately assess what their needs are, and diagnostic issues, therapy issues, treatment issues. So in a team like Heather's, we can do all of those things, from my evaluation to her clinical team's evaluation to the family evaluations, so that it's a comprehensive model to honestly help people heal. I mean, addiction and psychiatric issues are so common. There's such a stigma around them, and we need to get rid of the stigma and get people and identify people and get them the treatment they need to heal. So my Hippocratic Oath is my value, and I want to continue to do that in a way where we can provide those services and help people heal. That's really the main issue.
That's great. And who inspired, or what, I suppose, inspired you to pursue the career you have today?
Wow, that's a big question. I was originally trained in philosophy and religious studies, and as a young person after college worked in a psychiatric hospital and met many people and found it extraordinarily interesting. And I had many mentors over my life, from philosophers and theologians to psychiatrists and psychologists, that kind of led me into going back to medical school after I had finished a master's in theology, essentially. And there's too many to mention, but Jerry Kagan, Eric Erickson, who I actually met a few times, to many of the psychoanalysts when I did a lot of my psychoanalytic training. I didn't complete my psychoanalytic training. I decided not to practice psychoanalysis, but many analysts that I knew and worked with through the course of my training, and many top-notch scientists. Dr. Charlie Nemiroff was my psychopharmacology mentor. He was the chairman at Emory when I was there. Extremely gifted scientist, a bit of a controversial figure, but extremely gifted scientist, and have been a friend for many years, and several other people.
A lot of people have sort of informed and helped you on your sort of journey to where you've got.
Yeah.
And what would be the best advice that you could give to someone who is struggling with a mental health condition or an addiction?
Is go get help. It's a real thing, and help is available. It's treatable. I mean, it's a treatable condition. It can't suffering. There's no unhappiness too great to be lessened. When they seek out treatment and stick with the treatment, it can be completely life changing.
It absolutely can, yeah. And what do you enjoy doing when you're not working?
My great love is playing the guitar. I've been playing for 45 years. Take a weekly lesson. I've gotten into jazz in the last 15 years, and that's extremely challenging. Really challenges me every day. I'm still not very good at it, but I certainly love it.
I love jazz as well. There used to be a club in London that was back in the day where you could go and everyone could smoke, and it was really smoky and sort of dark. It was called Ronnie Scott's, and it was I used to love when I was at university. I used to love going there.
Wow. Yeah. Jazz clubs almost have to be smoky, even though it's not good for your health, but it's something about it. They should find a way to pipe in like less medically risky stuff that looks like smoke. That's what they should do. But jazz is an amazing art form. It's truly a living musical conversation, So.
Yeah. And really technical as well, I think.
Oh,
really difficult.
Oh, extremely, but I certainly love it. It's inspiring and humbling at the same time.
So last question, which is, what is your secret talent? What would that be? Again, the guitar.
I guess, yeah. I would guess I did that. That would probably be, I don't know if it's so secret, but it's.
Yeah. Well, Brad, it was an absolute pleasure meeting you and getting to know you. And thank you so much for your time.
Okay. Tell England hello for me, and maybe we'll get over there someday.